Hello everyone, I am Dr. Siddhartha, consultant interventional cardiologist at Tagore Hospital, Mukundapur, Kolkata. Today I will be discussing with you about a very important topic, that is hypertension. Hypertension is one of the most common cause of clinic visit to the doctors, and it is also a very important cause of mortality and morbidity, because hypertension can lead to a lot many complications, including heart diseases, kidney diseases, brain diseases like brain stroke, and many other organ dysfunctions. So basically hypertension, not only it is very common in almost every household, but it is also very deadly disease that can kill a patient in a long term, causing many complications. So first of all, what is hypertension? Hypertension means elevation of blood pressure. We all know that blood pressure has two components, the systolic and the diastolic. Suppose we describe a blood pressure as 120/80. So the 120, that is the higher value, the value we write above, it is called the systolic blood pressure, and the value we write below, that is 80, 120/80, the 81 is called the diastolic blood pressure. Now these two, systolic and diastolic, why they are named different, why the values are different, how they are affecting our system, that is purely a subject of medical personnel that need not be understood by the common people. But what we have to know, that we can have a systolic blood pressure elevation, that can be called systolic hypertension. We can have a elevation of the diastolic blood pressure, that will be called a diastolic hypertension, or in most of the cases we have a combined elevation of both systolic and diastolic. Sometimes we have specific patterns, like in the young people we have often have a normal systolic value with an elevation of diastolic value. So the normal systolic but the diastolic BP is high, whereas in the elderly more than 60 years we often have high systolic value with a low or normal diastolic value. Suppose a person of 70 years old, more than 60 years old, the BP may be like 160/50, something like that. So the diastolic is getting low, the systolic is getting higher. So that is called isolated systolic hypertension. So there are different patterns of hypertension. Now we usually classify this blood pressure or hypertension when the BP increases above 140/90. That is, if the systolic BP is more than 140, we will term the patient as hypertensive, and if the lower BP, diastolic BP, is more than 90, we will term the patient as hypertensive. This is stage 1 hypertension, blood pressure more than 140/90. Stage 2 will be blood pressure more than 160/100, and stage 3 will be when the blood pressure is even more than 180/110, or the pressure is becoming a resistant hypertension. What is a resistant hypertension? When you cannot control the blood pressure even with at least 3 different groups of medicines. Suppose the patient has been prescribed 3 different groups of antihypertensive therapies, still the BP is not getting controlled. So that will be termed as resistant hypertension, and we have several methods to treat resistant hypertension. I will discuss in short later. Now the thing is, BP is not a stagnant thing. Remember that if you measure blood pressure 10 times over a day, the BPs will be different. Often our patient says that in the morning I found a blood pressure of 120/80, and in the afternoon I found it 130/85. But see, both the blood pressures are in the normal range, and the blood pressure will definitely vary. It will vary with your activity level, it will vary with your stress level, it will vary before or after meals. So if you measure the BP before breakfast and after breakfast, the BP will vary. So that there is nothing to be worried about the variation of the BP. Rather, if there is no variation, we are anxious. That can be some disease. So no, BP variation is a normal phenomena, and we have to look about the average blood pressure. It is not that the isolated reading will term you as a hypertensive. I mean to say, suppose one reading of a patient comes more than 140/90, but rest all his readings over that day or over few days are normal, then the patient is normal. The patient is not a hypertensive. Only one isolated high blood pressure reading does not make you a hypertensive. So these are some of the basic areas which unnecessarily cause anxiety in a patient's mind. That has to be cleared. Next thing is, there are different methods, I mean different steps to be followed before you measure the blood pressure in your chamber or in your home. And those methods, I mean, unless you follow those methods or those steps accurately, your blood pressure recording will be wrong. So suppose I give you an example, like if a patient just rushes to your chamber and without taking adequate rest, he or she, you measure the blood pressure of that patient, the blood pressure may be high. If the patient has taken coffee or tea within half an hour before the measurement, or if the patient has smoked 5 minutes before the measurement, so your blood pressure recording may be falsely high. So there are so many things, the way you sit, the place where you rest your hand, like your hand has to be rested on the table comfortably and the hand has to be at the level of your heart. So these are so many, the tightness with which you bind the cuff, the rate at which you inflate the BP cuff, everything matters. So I will make a separate video on the accurate methods of BP measurement, but those things can make your measurement erroneously wrong. So that is one important thing you have to look for. Another important concept you have to know that we often find that whenever a patient comes to your chamber for BP measurement, the BP may be falsely high. That is called white coat effect. White coat means a doctor wears a white coat, and whenever a patient visits a doctor, there is some anxiety going on in the patient's mind, and that elevates his or her BP. That is called white coat effect. If the blood pressure was taken at home, maybe the blood pressure would have been normal. So that is why nowadays we focus more on home blood pressure monitoring, and that is why you have to know the exact method of blood pressure and the steps you have to follow if you measure your blood pressure in your home with the automated machines. Next is another important measuring tool is the ambulatory blood pressure monitoring. Whenever we find a significant BP variation, like the BP between evening and morning time, they are varying largely. So in those situations, we advise ambulatory blood pressure monitoring. What is that? A cuff is wrapped around your hand. There is a machine recording your blood pressure, and the patient will be allowed to do all his activities, and the machine will automatically record the blood pressure every 30 minutes and every 15 minutes. During working hours, during daytime, every 15 minutes, and during sleep, every 30 minutes. So that will give us a complete graph of the blood pressure recordings throughout the day. There we will be able to understand what is his daytime blood pressure, what is his morning blood pressure, evening blood pressure, night time or sleeping blood pressure, because the sleeping blood pressure is very important. It is called a nocturnal hypertension. Normally when a patient sleeps, the blood pressure should fall by 10 to 20%. If it does not happen, that is very risky for the patient. That can lead to harmful effects on your heart. So you have to measure all those different recordings which is possible in ambulatory blood pressure monitoring. So these are the different measuring tools which we now we have the availability of those tools in our surrounding labs, and they are commonly prescribed by us, and we can easily detect hypertension. Now let us come to what are the if a patient has a hypertension, what may be the cause of that hypertension. More than 90% of the hypertension, it is called primary hypertension or idiopathic hypertension. Primary hypertension means it is multifactorial, it is often familial and genetic. You will often find a family history of hypertension in parents or in first degree or second degree relatives, and there we do not find any other secondary cause. And in rest 10% of hypertensive cases, we find secondary causes. Secondary causes means suppose thyroid disease that can cause hypertension, suppose kidney disease that can cause hypertension, suppose adrenal gland disease that can cause hypertension. So unless and until you cure that kidney disease or aortic disease or thyroid disease, you will not be able to control that hypertension. So they are called the secondary hypertension. So when a patient is diagnosed as hypertensive, and also remember that diagnosis of hypertension is not based on a single value, as I already mentioned before. It has to be an average of 2 or 3 recordings and over 2 or 3 visits. It is not that a patient comes to your chamber, if you find 1 BP high and you stamp that patient as hypertensive. It is not always so. You have to take a 2-3 readings, average those values. You have to ask the patient to follow up over maybe 1 week later or 2 weeks later, then again take his readings, and then you characterize or you stamp that patient as a hypertensive, and then you investigate the patient for secondary causes of hypertension. You measure the thyroid hormones, adrenal hormones, kidney, renal artery Doppler we often do. We often look into other aortic valve diseases or aortic diseases, and there are so many causes, which is not the topic of discussion today. So there are investigations like ECG, echo, chest x-ray, different hormonal assays, and then we try to find out if there is any secondary cause of hypertension, and this is particularly done in the young people, because of young people having hypertension, we often, unless we find the exact secondary cause, we will not be able to treat. So that is about the diagnosis, and then let us come in short about the treatment. There are different antihypertensive medications available nowadays. We are having more and more developed and advanced medications which are able to control the blood pressure much more optimally and much more effectively, and there are different groups of medicines. We prescribe a particular group of medicine in a patient based on his or her age, based on whether the BP is systolic hypertension or diastolic hypertension, based on whether there is any secondary cause or not, based on whether there are any comorbidities or not. Like if a patient has heart attack and also has hypertension, his treatment will be slightly different than if the patient has a kidney disease and hypertension. If the patient has a stroke and hypertension or a hemorrhage, brain hemorrhage and hypertension, his choice of medicine will be slightly different than the other groups. So this choice will be made by your cardiologists or your physician, and then only it should not be a over the counter medication, because I often find a patient had detected hypertension, goes to the local medicine shop and ask for medicines, and the local medicine shop owners, they prescribe a common group of antihypertensive and they keep on taking that medicine. That is absolutely not advisable, because that can cause more harm to you. So you should visit a doctor, do the investigations, and then you start to treat. Now if it is not controlled with 3 or 4 group of medications, that is called resistant hypertension. In those situations you have certain second or third line medications which are not commonly prescribed. And here also I must mention that often I find in the peripheries, in the rural setup, these second or third line medications are given very early in a hypertensive patient. That also should not be done, because these second or third line medications have lot many side effects. So that should be prescribed only when blood pressure is not controlled by the common group of medications. So that is one thing. Then we have certain surgical procedures like renal nerve denervation, baroreceptor stimulation. Those are advanced therapies, advanced treatment options which you have to consult with your cardiologists in some good tertiary care centers, and then you have to advocate that. So that is regarding the causes and management. The more important thing is you should start screening for hypertension after 40 years of age, and if you have a strong family history, even in the young people, you should start to screen for hypertension, because checking blood pressure in a young also once or twice a year is not anything, I mean it's not going to harm you. It will rather lead to early diagnosis, and you can prevent the complications very early. And then regarding prevention, of course, whenever you are detected hypertension or you have a family history and high risk of hypertension, you should restrict your salt intake. We advocate, we ask the patient to avoid any added salts or salty foods. So the minimum amount of salt that is required for cooking your vegetables or fish or dishes, that is okay, but you should not take any additional salt with your diet, or you should not take salty foods like the snacks, the achars. So they are salty foods and you should avoid those things. You should also have a restriction on your fat intake. You should exercise and you should reduce your weight if you have an obesity, and obviously you should avoid smoking or other addictions, because that will increase the risk of hypertensive complications. And hypertension can lead to heart attacks, hypertension can lead to heart failure. Two most common causes of death or morbidity in a hypertensive patient is heart failure, heart attacks, and renal disease, kidney disease. So you have to detect early, you have to treat adequately to prevent these complications, and that is quite possible. That if you detect hypertension early, you can prevent or delay these complications by many years, and you can stay healthy. It is a well controllable disease. Hypertension is can be well controlled if properly detected and treated. So thank you. Be healthy and screen for hypertension, and if you find hypertension, do visit your cardiologist and start treatment early. And if you have anything else to ask regarding hypertension, you can mention in the comment section and I will reply. Thank you.